Most people believe that health checkups equal better health care. But what if I told you that after 70, some of the most routine screenings could actually shorten your life? It sounds counterintuitive, I know, but the reality is that not every health test designed to protect you actually does. In fact, many of the screenings automatically offered to seniors can trigger a dangerous chain reaction of unnecessary procedures, false alarms, and treatments that do more damage than the conditions they're meant to prevent. This isn't about being anti-medicine or ignoring your health. It's about understanding that your body at 70 has different needs than it did at 50, and the medical system hasn't always caught up to that truth. More doctors are starting to recognize that aggressive screening in older adults often leads to overtreatment, and some are even declining these tests for themselves and their own families. In this video, we're going to examine 5 common health screenings that many seniors would be better off skipping. We'll look at why these tests are still routinely recommended, the hidden risks they carry, and what you can do instead to truly protect your health and quality of life. You deserve medical care that honors your age, respects your goals, and doesn't put you through unnecessary ordeals. If you're someone who wants to stay healthy, but also wants to avoid being caught in the web of over-testing and over-treatment that has become so common today, this video is for you. We're not trying to frighten you. We're here to give you the information you need to make confident decisions about your own body. Let's dive in. Number 1. The colonoscopy dilemma. For years, colonoscopies have been held up as the gold standard for preventing colon cancer. But after age 70, particularly if you have no symptoms or family history, this procedure can become more risky than beneficial. What once made perfect sense in your 50s and 60s can, beyond a certain point, transform into a source of unnecessary danger and stress. The procedure itself is demanding. It requires intensive bowel preparation, sedation, and the insertion of a flexible scope through your entire colon. That's challenging enough for younger adults, but for seniors, the risks multiply. The bowel prep alone can cause dangerous dehydration and electrolyte imbalances. The sedation can linger longer in an older body, causing confusion and increasing fall risk. But here's what's even more troubling. Many older adults end up having follow-up procedures after a colonoscopy finds small polyps that may never have caused any harm. These slow-growing growths typically take 10 to 15 years to become dangerous, and for someone in their 70s or 80s, that timeline may be irrelevant. Yet finding them creates anxiety and sets off a cascade of additional procedures, biopsies, and even surgeries. I remember hearing about Margaret, an 84-year-old woman who was active and healthy. She agreed to a routine colonoscopy despite having no digestive complaints. The prep left her severely dehydrated, and after the procedure she was dizzy and fell at home, breaking her wrist. The scope found a tiny polyp that would likely never have affected her health. That single test led to months of recovery and medical complications. This isn't about criticizing doctors, they're following their training. But medicine is evolving, and we need to evolve with it. If you're over 70 with no symptoms, it's completely reasonable to decline a colonoscopy. There are safer stool-based tests available that can be just as effective for many people. It's about weighing the real costs against the potential benefits. Number 2. The full-body scan illusion. The idea of a full-body scan sounds appealing. Having advanced imaging look through your entire body, catching problems before they become serious, seems like smart prevention. But for seniors over 70, this approach often creates more problems than it solves. These scans frequently detect what doctors call incidental findings, abnormalities that would never have caused symptoms or affected your lifespan. These findings can become sources of tremendous anxiety. A small shadow here, a tiny nodule there, and suddenly you're on a medical merry-go-round of follow-up tests, specialists, and procedures. The older body doesn't recover from these interventions the way it used to. A biopsy that might have been routine at 45 can now lead to complications like collapsed lungs or infections. I met a woman named Dorothy at a health seminar. She was 76, energetic, and had no health complaints. She got a discounted full-body scan at a health fair that found a small spot on her liver. That spot had probably been there for years and would likely never have caused problems. But the discovery led to months of testing, a biopsy, and tremendous stress. She later said she wished she'd never stepped foot in that scanning machine. Full-body scans aren't typically covered by insurance unless there's a specific medical reason. Many seniors pay out of pocket thinking they're buying peace of mind. But what they're often buying is a ticket into a system that may never stop testing. Number 3. The stress test trap. Cardiac stress tests have long been considered essential for detecting heart disease in older adults. The concept seems logical. Put your heart under controlled stress and see how it responds. But after 70, this logic can backfire in ways many people don't expect. The problem is that stress tests in seniors often produce false positives. As we age, our cardiovascular systems naturally change. Arteries become stiffer, blood pressure fluctuates more, and the heart's electrical patterns shift. These changes don't necessarily indicate disease, but the stress test can't distinguish between normal aging and actual problems. When the test suggests something might be wrong, it can trigger a cascade of additional testing, including angiograms, catheterizations, and sometimes even unnecessary stent placements or bypass surgeries. For seniors, these procedures carry significant risks, including bleeding, kidney damage, and difficult recoveries. I know of a 73-year-old man named Robert who had no chest pain or shortness of breath. His doctor ordered a stress test just to be safe. The results were abnormal, leading to a catheterization that showed some minor blockages. He ended up getting stents he probably didn't need, followed by complications from the blood thinners that landed him in the hospital. All from a test for a man who had no symptoms. Many heart specialists now recommend against routine stress testing in older adults who don't have symptoms. If you're not experiencing chest pain, shortness of breath, or unexplained fatigue, the test may cause more harm than good. Number 4. The mammography question. Mammograms have been promoted as essential for all women, but after 75, the benefits become much less clear while the risks remain. Mammograms can detect cancers that grow so slowly they would never have caused problems in an older woman's remaining years. This is called overdiagnosis, and it leads to unnecessary treatments including surgery, radiation, and chemotherapy. The psychological impact is also significant. False alarms from mammograms are common, especially in older women. These false positives can cause months of anxiety and lead to unnecessary biopsies and procedures. The stress alone can impact quality of life in ways that outweigh any potential benefit. For women over 75, especially those with other health conditions, many experts now suggest that routine mammograms may not be worthwhile. The focus should shift to being aware of any changes in your breasts rather than routine screening. Number 5. Bone density overscreening. Osteoporosis screening seems important for older adults, but repeated bone density tests can lead to overtreatment with medications that have serious side effects. Many seniors are prescribed bone-building drugs based on test results alone, without considering their individual risk factors or the medication's potential complications. These drugs can cause unusual fractures, jaw problems, and digestive issues. For many older adults, especially those who aren't at high risk for falls, the medications may cause more problems than they prevent. Exercise, proper nutrition, and fall prevention are often more important than aggressive drug treatment. Final thoughts. Growing older doesn't mean you should accept every test that's offered. In fact, it's often the time when you're wise enough to ask better questions. Healthcare in your 70s and beyond should be about maintaining your quality of life, not chasing every possible problem. The key is having honest conversations with your healthcare providers about your goals and values. Ask whether a test is likely to change your treatment or just create more worry. Consider your overall health, your life expectancy, and what matters most to you. Remember, saying no to certain tests isn't neglecting your health. It's being thoughtful about what truly serves you at this stage of life. You've earned the right to make decisions based on wisdom, not fear. Thank you for watching. If you found this information helpful, please like this video and subscribe to our channel. Share your thoughts in the comments below. We'd love to hear about your experiences with medical decision-making. Your engagement helps us continue creating content that empowers you to make informed choices about your health. Until next time, stay informed and stay empowered.